Now we'll look at some bacterial drugs. Okay, just the end of the different classifications of bacterial drugs. So look at what is the sulfonamides. We'll describe them, talk about the examples of drugs that fall under this category. We'll look at the DNA gyrase. We'll discuss them, talk about drugs that fall under this category. Then we'll also talk about drugs used in treating tuberculosis. That's the antitubercular drugs. Now for what we got, we'll just go step by step. So sulfonamides, we said that they are analogues of what's para-aminobenzoic acid. They inhibit a very important enzyme that should have led to the formation of folic acid or folate for the bacteria, and that enzyme is known as the dihydropteroate synthase. Okay, dihydropteroate synthase. So they'll block that enzyme and they'll scatter that whole process. So we have drugs like what? The sulfamethoxazole, we have the sulfadiazine, have the sulfasalazine, then they usually combine with trimethoprim, okay, so that as the other one is inhibiting this enzyme, trimethoprim is inhibiting this other enzyme. Do you understand? So there's a synergistic activity. So adverse effects can lead to hypersensitivity reaction, lead to hemolysis, lead to kernicterus, lead to crystalluria. You are basically having crystals in urine. The DNA gyrase inhibitors, okay, different drugs like the Quinolones, the Fluoroquinolones, okay. Examples, we have the popular drugs like the ciprofloxacin, the levofloxacin, the oflofloxacin, the mosifloxacin. So they are mainly used in treating the urinary tract infections, gastrointestinal tract infections, respiratory tract infections, and all of that. So adverse effects can cause tendon rupture, tendinitis, QT prolongation, can cause effects on the central nervous system. Okay. Then for the antitubercular drugs now, they are just drugs used in treating what infections specifically caused by the tuberculosis bacteria. Tuberculosis leprae, then with tuberculosis, the other one that causes the main tuberculosis. So we have drugs like the rifampicin, we have drugs like the isoniazid, we have drugs like the pyrazinamide, okay, they bring the picture. We have drugs like the ethambutol. So second line drugs can use drugs like the streptomycin. You can involve levofloxacin, mosifloxacin. They have fluoroquinolones. You can give cycloserines, you can give ethionamide, you can give capreomycin. Okay, so that's what we got for these different drugs, mainly using treatment. We'll come back and talk about the pharmacology of each.